season because of spider veins of cellulite. Get ready to break out that swimsuit because new technology will get rid of both problems all summer long. And here to show us how is new beauty magazine editor-at-large, Marie Zenko-Cashel. Welcome, Marie.
Hi, Elizabeth. Thank you, Star.
I want to start with this first treatment, which you say is perfect for getting rid of spider veins, right?
You got it. We're going to send those spiders scrambling away. Dr. Bruce Katz is here to show us this Cynosure Synergy Laser. It's the newest technology in getting rid of spider veins.
Okay.
First, we are going to put on these safety goggles. This is a laser. One of the safety precautions is to protect the eyes. The other precaution is to have a qualified doctor, a dermatologist or plastic surgeon. Dr. Katz is a dermatologist.
Okay.
So what Dr. Katz is doing, the light beam, two different sources of light are emitted onto the spider vein. They simply attack the blood, coagulate it, the vein is obliterated, the surrounding tissue is left healthy and intact. You might need 1 to 3 treatments to completely clear the leg. We have some before and after results that we can show you. About $400 to $600 a treatment.
Wow.
There's not a lot of downtime with this. You might have a little bruising, a little streaking after the treatment, but we can completely clear the spider veins from the legs.
Okay. So
what are the pros and the cons, though? That's the thing that worries me.
Really, the only con for this is that you shouldn't use it for the larger varicose type or bluish veins. These are only for the fine spider veins.
Okay.
There's really not a lot of potential for any injury because, again, these are just the spider vein, the benign veins.
Gotcha.
A little bruising, a little discoloration, that's your downtime.
Not a whole lot of pain.
And 3 to 4 treatments.
A little bit of snapping, a little bit of energy. 1 to 3 treatments, really. In 3 treatments, you should get complete clearing.
Okay. Another option that we want to talk about for getting rid of spider veins is called sclerotherapy. Is that correct? And this is here, we're looking at it here, and this is a little more invasive, we'll call this.
Well, sclerotherapy is the original treatment to treat spider and leg veins. This is much better for the larger leg veins. Again, they must be benign veins. Sclerotherapy has been around for about 100 years. We've got some before and after images. Dr. Marina Pareto is here and she's going to show us. What happens is that a sclerosing solution, something that is going to basically go into the vein,
I don't want to see this.
push the blood out, and irritate the walls of the vein. So again, it collapses and it's obliterated. As you can see, it's just traveling. The solution travels right through the vein and seals it away, pushing the blood out.
It went right away.
Yeah, it's gone.
So
it's gone.
You have to be pretty precise then, getting that right.
Well, indeed you do, and that's part of the reason for having a qualified doctor. The other reason is that there's a very limited risk, if you don't have a benign vein, of potentially developing a blood clot. You want to make sure that your doctor is well equipped, well qualified to be able to do this. 1 to 3 treatments, much like the laser. $400 to $600 a treatment, much like the laser. Again, this is the bigger veins. You might have some cramping, a little bit of a stinging sensation.
So, I just want to be clear. You say this is better for the bigger veins.
Bigger, benign veins.
Will they come back after these treatments?
The same veins will not come back. You always have the potential for developing new veins. That's why it's important to have good, healthy circulation in your legs to prevent the veins from forming in the first place.
Okay. All right, great. Well, another thing I want to talk about today is cellulite. It plagues pretty much every woman, especially when the thought of getting into a bathing suit is nearing. This is called VelaSmooth.
This is called VelaSmooth.
And how does this exactly work?
Well, VelaSmooth is a step up from what was the original technology to treat cellulite. We can treat it, we can't cure it. We can make it look better. So earlier we pre-taped, this is Dr. Sharon Giese, her patient. You can see the cellulite when you're standing. The technology of VelaSmooth is this. It's a massaging and rolling action, much like endermology, which was a precursor, but it also adds to it a light and radio frequency energy. Penetrates the skin to help shrink some of the fat cells and contract the elastin fibers that actually weaken and cause cellulite as we age. This will require about 10 to 12 treatments to see your initial results. Can cost as much as $3,000 for that cycle. Yes. And then afterwards, about every 6 to 8 weeks, you'll want to have a treatment to maintain the results. We have some before and afters of a patient who's had the full cycle of treatment so that you can see it really does a beautiful job of taking care of kind of that lumpy bumpiness, the little bit of orange peel skin that develops.
All right. Can you just do this with your vacuum cleaner at home and save $3,000? I'm just wondering because I might try.
Is it painful at all? Because I know that's what a lot of
It's actually a massaging, warming action. It's actually very comfortable. There are people who say, hey, can you keep doing it? Because it really feels good actually on the skin.
Not when it costs $3,000, can you keep doing it? Keep going, baby.
Now, one thing women also complain about are bigger dimples, okay, that are pretty indented. How do you treat that? You do this with Restylane, is that right?
Restylane is what we have here today. Restylane is a facial filler typically used to fill facial creases and wrinkles and even to enhance the lips. We have Dr. Jeanette Graff here, who is actually injecting the Restylane dimple, and what she's doing is filling it out so that it can raise the skin tissue and create a nice smooth effect.
Oh, I see that happening.
Okay, so
And it does happen fairly quickly.
It happens instantaneously. We've got some results up on the screen. Anywhere from $600 on up for this treatment. The results will last about 6 months, but as you can see, Grace had some great, incredible improvement.
So this is something that you would do leading right up to the summer, and you'd have to do it again every year.
I would do it 2 weeks before the beach, because you might have a little redness or swelling after the treatment that you'll want to go away before you hit the beach.
Okay, now how painful? Come on, needle.
You know what? A little bit of topical anesthetic and you're fine.
Okay, great. And do you have to be careful of the sun when you're doing most of these, right? If you're going to hit...
With any one of these, for the 2 weeks that you might have some post-redness or swelling, stay out of the sun, because that can cause some pigmentation problems. Regardless of hitting the beach, have your sunscreen on.
Okay.
Doesn't matter whether you've been treated or not.
Thank you so much. Our thanks to Marie Zenko-Kushel and the doctors and their patients for joining us today. When we come back, R&B star Neo is singing his latest hit. We're ready for the beach now.